Welcome to HealthTech with Purpose podcast. Today we talk about the intersection of technology, health, and strategy with founder of AB Health, Kim-Fredrik Schneider. Kim, a seasoned CEO and health technology entrepreneur, co-founded Abi Global Health in 2016 with a bold vision to make professional healthcare radically accessible for all. With over 15 years of leadership experience in high-growth tech firms across the globe, Kim's expertise has propelled Abi Global Health to remarkable success. Under his guidance, Abi Global Health has revolutionized telehealth utilization, service innovation, and customer growth worldwide. Today, the company delivers on demand healthcare to over 15 million people in 40 countries, leveraging a unique blend of real doctors, artificial intelligence, and machine learning. Join us as we delve into Kim's journey, insights, and transformative impact of every global health on global healthcare accessibility. Hello, Kim. How are you today? Welcome to Health Tech with Purpose podcast. So, how are things at your end of the world?
Hi, Ayush. Great to be here. Thanks for taking the time to chat. Things are going well in sunny Barcelona at the moment, visiting our office here. Life is good. Yeah. How are you?
Very nice. Same. Yeah, I think this is a good year for all of us. Hopefully, that's the wish, and just striving to keep it going. But yeah,
Excellent.
glad to be connected for today's podcast because the some of the work that you have done is very disruptive for health. So since at Health Tech with Purpose, we are consistently speaking with different founders who are changing the course of health, and we get to know different viewpoints. One of the things that stood out when I was speaking with you earlier is the disruption that you're building and bringing in telehealth space. So why not you explain in your own words like what Abi Global Health is all about and what is the kind of impact you have been able to do?
Yeah, sure. So what I would say is that the big problem we're solving is one of healthcare access and health equity. And we know that that's really a global issue with relevance for everyone in the world. And one of the most intractable drivers of this inequity, and really one of the key factors in stopping people from accessing healthcare, is an undersupply of healthcare professionals. So the world is missing about 10 million doctors, probably about 25 million nurses. And that's not a poor country problem. It's a universal problem.
Right.
And right now what happens is, this country steals doctors from that country and that country steals doctors from this country.
Right.
And that's not a solution. And it takes about 15 years to make a new doctor. That's also not a solution, not in the short term. So the only option we have today is to use the resources we have more effectively. And fundamentally, what we're doing is deploying innovative technologies like AI to both allocate and use healthcare professional resources more efficiently. We can get more into the business model, but that's really the basis of our approach. And we encapsulate our mission as being to make professional healthcare as easy to access as advice from a friend. And we see that as having three parts. Number one, everything we do involves healthcare professionals. Easy to access is our obsession. And advice from a friend, that means that we build empathy into all of our solutions as well.
Yeah, sounds like everything that we need today to fix healthcare. So that's awesome.
I don't know it's everything, but it's a big piece of it. Yeah.
Yeah. So what led you to getting started on this idea? Tell us a bit about your background and your story.
Sure. So my personal connection to healthcare started at a very young age. My best friend from the age of 4 was born with a genetic condition that led to a very medicalized childhood. And it's the kind of thing it's actually taken me years to really think about and get comfortable with myself. I think that for all of us, whatever our childhood was like, that was normal. That was reality. And sometimes it's not until you're an adult that you really start to process and think about, how typical that situation was. So I was around, a close friend whose childhood was very medicalized, and I think that that experience, and particularly losing him when we were 12, that really triggered in me a deep interest in medicine. And in fact, even the name of our company is inspired by his name. It's been really a driving force for my life journey. And I initially wanted to study medicine. I couldn't quite hack it when it came to chemistry, but it was always an area that I really insisted on working in. So I found a role as an executive vice president at a company called Sermo many years ago. Sermo is a global network, social network for doctors. So I was leading a team of about 200 people across 8 offices there, selling services into the pharmaceutical industry, which was very rewarding in many ways. But while I was there, I was looking at what was going on in the telemedicine space, and I saw really a profound lack of innovation. So it appeared that most telemedicine companies were basically clinics with Skype instead of a front door, but they hadn't done anything to really transform the business model or really critically the unit of interaction between the patient and the doctor, and also the associated cost of that interaction. So to me, it seemed logical to use this network approach, this global network approach that we were using at Sermo, but to apply that to direct patient interactions. And I was introduced through a mutual friend to my co-founder, Dr. Victor Vicens, who is from Barcelona, although he did a residency at Mount Sinai in New York and also part of his medical degree in France, and had been working for many years in the telemedicine space after practicing medicine for many years before that. And it was really a meeting of minds. He had the experience that traditional telemedicine didn't scale. It was very expensive. People weren't using it in those days before COVID. I came to him and I said, look, on the scalability, on the cost side, I've got a radically different model for that. For me, the challenge was, what's the business model here? He had some great answers on that side. And then together we worked on this question of, why don't people use it, right? What's wrong with the traditional user interfaces? There's a lot more to say about that, and maybe we can get into later, but we essentially look to solve those 3 fundamental issues. And then another critical piece in that journey was we wanted to make sure we had a solution that was for everyone. And I feel very strongly about this. I think if you're going to be innovating in the healthcare space, you have to innovate for everybody. You have a moral imperative that if you have a solution that is actually delivering better health outcomes, that's something you need to find a way to do globally, not just in the wealthiest countries in the world. So from the beginning, we designed our service to have integrated AI, and we designed our service to work in every kind of context in the world. Both of us had a lot of experience in sub-Saharan Africa, previous to founding Abi, for example, and we really insisted that it's a service that is going to work for everybody in every context.
That's great. So tell us, what are the major differentiators that Abi has, compared to other telehealth solutions? Like you mentioned, telehealth solutions are all around, but what increases their effectiveness according to you?
Yeah, in some respects, one of our challenges is that we did everything differently. So it's been hard to encapsulate that, in our marketing, frankly. We can break it down in a few ways. So one is that question of why were people not using telemedicine before COVID? Everyone's been celebrating the increase in telemedicine, but I still think the right way to put that is, what's wrong with telemedicine that it took a global pandemic for people to start using the product? I mean, think of all the other tech success stories out there. Imagine if it took a cataclysm to make Facebook work or Google work, right? So for us, the fundamental issue with the traditional approach to user interfaces for healthcare is, if I were to ask you next month, how many times do you plan to eat pizza or take a taxi or watch Netflix? These are all things you can imagine yourself doing. And if I said, hey, download my app and you'll get, 15% discount on all those things, yeah, you'd consider downloading the app. How many times do you plan to be sick in the next month?
Mm-hmm.
You see the issue, right? So obviously there are people living with chronic disease. That's a very different story. And I think that things like an app or a full user journey is really appropriate for that. And I'm not saying that they're not appropriate in other contexts as well, but it's a very difficult thing to engage with somebody on. The fact that we all know we will need healthcare, but none of us plan to need it in the near future. So if you make an offer of, sign up for this program or download this app, that's very challenging. And this is a well-known issue across the space that customer acquisition costs are very, very high in healthcare. Again, because people don't plan to need it. So what our view on that from the beginning was the answer to that problem is to be there at the moment that people need you. Mm-hmm. And the best way to already be there is to build models that integrate into existing user interfaces. So rather than being yet another telemedicine app, we don't have an app now, and we've never had an app. We have an app for our healthcare professionals, but that's a different story. But for the patients, we have no downloadable app. A lot of our clients have apps, and they use our APIs to integrate our service into their apps. Mm-hmm. They have lots of other reasons for people to download those apps, which is great, but that's not the business that we're in. So we have an API interface that integrates into other people's platforms. We have a widget that can integrate into a website or into an app. And then we also are integrated with every messaging service out there. So the service is available through SMS, through WhatsApp, through Telegram, through Viber, which is big in some countries, through Line, through Kik. I mean, really name an app and we're in it. And we've used that chatbot interface as a mechanism for delivering the service to people. I've often compared it to somebody knocking on your door and saying, I've got a pizza for you. I'll just stand outside. Let me know when you're hungry, right? That's kind of the model we use. Right. So that's one piece. The second piece is the way that we allocate physicians or healthcare professionals generally to a case. And this is also really a radical change. I think for as long as there's been healthcare, there has been this appointment paradigm, mm-hmm. to the point where people even use it as a metaphor for seeing a doctor. I have an appointment. I have a doctor's appointment. How did your appointment go? It's this whole idea that you need to book a time when you're available and the doctor's available, and then cross your fingers that when you get there, they're ready for you. And the doctor's crossing their fingers that you actually show up. There's a whole industry of just getting people to show up to their appointments, right? So what we realized is that with the vast shortage of healthcare professionals, that's not a sustainable paradigm. And we have completely smashed that paradigm and moved to an on-demand approach, which is, again, what's possible with algorithms. Mm-hmm. So what we do is when a patient has a need, we use algorithms to match that need to the best available healthcare professional. Lots of factors are taken into account. Some of that's just hard-coded business rules like language or a specialty, but a lot of it's more subtle things. What is this doctor proven to be good at answering in the past? What is the predicted availability? And again, by using that predicted availability model, it means on the healthcare professional side, we don't need to schedule, we don't need to book, we don't need to hire, and the doctors have a zero commitment approach on their side, which again is a radical difference for them, that we figure out when they're available. They don't have to tell us when they're available. And what's the net impact of that? The net impact is that we're connecting people to a doctor in less than 30 seconds, 24 hours a day across 40 countries. Imagine that, 40 countries, 24 hours a day, less than 30 seconds. We have markets where median match time is about 10 seconds. I mean, that is a radical shift from make an appointment next week. And again, that completely changes the availability of professionals, just that piece alone. And then the last piece, well, the last big piece, because there's a lot of little stuff as well that we've innovated, but the last really big innovation is something that people are just starting to talk about now, but we've been doing since 2016, which is to integrate AI into the consultation itself to reduce the amount of time that the healthcare professional takes per consultation. And that's that fundamental cost unit, right? Again, the traditional telemedicine model, you're replacing a 15-minute visit with a 15-minute visit. You're just not saving money. And it's causing havoc across the world now that people are actually using telemedicine post-COVID. It's unsustainable cost-wise. It's unsustainable from a resource perspective. We need to deliver the same or more value from that consultation but with less physician time per case. And there's a number of ways that we've done that. One is the way we architect the consultation itself. And then there's a lot of tools that we use to support the HCP during the consultation that makes it much more efficient. So the net result is that we're about 3 to 9 times more efficient than a traditional telemedicine consultation, much less a traditional face-to-face visit, with really radical implications for anyone paying for healthcare. So for insurance companies, for pharmaceutical companies, for public payers, for large companies, a whole slew of people who are interested in delivering healthcare more efficiently.
Great, that's good to hear. And I think you said it right now. I can realize, that small things, but they all add up to make that big difference. Some of those things seem so subtle, which I, in my terminology, call it magic beans. So magic beans are something that, like people don't realize when they are not there, but if they're there, it makes them happy. So people really just think that something is missing, but they don't know. And then there's this magic bean. So now it makes.
I like that. We might steal that phrase. I like that.
That's fine. That's
I'll use that internally.
Thoughts. Yeah. Yeah. In fact, another thing that I would fully agree from my own work as well is that, I always suggest the integration first. So, you are pretty much echoing my thoughts that, you should not be building standalone, health applications. So you should be building like integrations, because nobody now has the time to, log into a separate system, or your users,
exactly,
both providers or, users have time to log in.
And integration in and integration out.
Yeah.
Right, both directions. So I think for us that's critical. And this point about login, absolutely, right. So we architect our services so that you have access to them, and there's no sign up. And not all of our clients have adequate amounts of customer data or can share their customer data. But for the majority of them who do, that means you have a very smooth system where we already know who you are when you come in, and then we can send you out. We have clients, for example, who offer us as a check-in before you make an appointment with a specialist, for example, and we're able to then transfer what we do on into the rest of their medical record. So I think it's integration on the way into the service and integration on the way out, and as much as possible bringing the service to where the user is, not making the user come to you.
Right. Great. So yeah, moving forward, this is very interesting and a lot of learning, especially for the listeners. So till now I've understood, that you saw and realized the doctor shortage crisis, and that led you to start building Abi. So tell us, the present state of things in terms of COVID has come and gone, and I think, in the positive sense, probably more people are now open to start using a telehealth solution for their needs and stuff. Maybe it means more competition too, maybe, I don't know. But you tell us, like, what are the key differences you have figured now in the last few years? Like, how have been things? What are things which are positive signs? Any bad signs also, if you can share? So how is the overall market moving along? This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health, where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Yeah, it's been interesting to observe and to be part of this process. So initially there was a huge surge in telemedicine usage post-COVID. We actually did some very interesting work ourselves. We were able to predict COVID waves in countries by about 2 weeks in advance using our AI labs, natural language processing technology to.
What are your biggest markets?
To analyze.
What are your biggest
Oh
markets?
gosh, I mean, basically the biggest countries, but we're all over the world. So I mean, and not always the markets you would expect. I mean, we're big in Romania, we're big in Switzerland, but we operate, in the U.S., all over Asia, Eastern and Western Europe, South America, North America. We're all over the place. So yeah, it's and because we operate B2B, our markets are really about where our clients want us to be. And I think that this question of COVID, that's what's been quite interesting to see is how the various healthcare payers have reacted to this surge in usage. So the big promise of telemedicine, of traditional telemedicine, was that it was going to save money, and it hasn't. So what's happened is there's actually a lot of panic among both private and public payers, insurance companies, employers, and others, and they've found that. Actually, again, it's something that we've always said, but finally, it's like the emperor's new clothes, right? Some people are finally realizing what was always true. Again, if you replace a 15-minute consultation with a 15-minute consultation, surprise, surprise, you're not saving money. And so it's actually becoming quite unsustainable because it leads to incremental consultations in many cases that weren't happening previously, which from a health perspective is a good thing. People should be having those consultations, but from a cost perspective is unsustainable. And also, again, in terms of pressure on healthcare systems. So there's a real challenge among healthcare payers, particularly insurance companies, which are, we work with most of the big insurance companies in the world. And a lot of these companies have really struggled with traditional telemedicine models and are looking for an alternative right now from a cost perspective. The other thing that's happened is that venture capital has been much harder to come by over the last 18 months than it was previously. And that's had an effect. Again, these traditional telemedicine models that don't touch the basic unit of cost, they tend to have gross margins of 20 to 30%. With our model, it's significantly higher. We're a much more efficient business and much less capital intensive than they were. And essentially, VC was subsidizing these inefficient telemedicine models. And when that capital started to dry up, what's happened? Well, companies have been pulling out of countries. They've been firing clients, and some of them are going bankrupt or have gone bankrupt. I don't need to name names. Those in the industry know who I'm talking about. And that's, again, a big problem for the insurance companies, the pharmaceutical companies, and others who rely on these kinds of telemedicine services. But again, for us, not a surprise at all, because these models were not adequately innovative and really suffered from this fundamental issue that they didn't change the basic unit of cost in the interaction. So in the insurance sector, that's really what's been going on, is people are realizing that these models are not sustainable, their suppliers are not reliable, and they're looking for alternatives. What we're seeing in the pharmaceutical industry, which we work a lot with, and is a little bit more unusual for telemedicine companies, is that there's a renewed interest in these kinds of services, particularly for things like patient support programs, patient education. There's a lot of work that they sponsor that involves patients interacting with healthcare professionals, where, again, the efficiencies of these models, the patients' expectations are changing, and more efficient models are appropriate.
Right. No, I again very much echo, because like remote patient monitoring is overall coming up big time, and there's a lot of push, especially in the US or in the UK as well, I believe, to how to keep patients not come to the hospital. And I think that would all have the aspect of telehealth, and how do you keep someone healthy or keep monitoring them by practicing.
Well, the default response to a lot of this, again, this question of how do we stop people from consuming unnecessary healthcare, the default response for years has been make it harder. Right. So, I mean, the NHS ran a program a few years ago, which is something like 5 things to do before you call your doctor. Right. So they're trying to keep people away from doctors. What's really so radical about our approach is about what we're doing at Abi is that we can actually give you more consultations, more interactions, lower the barrier to access, and at the same time, reduce the pressure on the system and reduce the cost.
Right.
And for me, that's the true promise of technology. That's exactly what technology delivers. Is it delivers more for less money.
Right.
not the traditional paradigm of less for less money.
Right. In fact, you would be happy to hear something I'm going to share. I was listening to a talk from Vinod Khosla, one of the VCs,
Sure.
big VCs. So he was mentioning that with AI, he foresees a future where every person would have a personalized doctor. So, that's one of the big impact of AI he sees. And, what you are building, Kim, is pretty much in the same lines. Like, how do you get access? And, with more and more AI aspects getting added, I believe you'll also be part of that revolution that is going to happen.
Well, this raises a very interesting question about the role of AI versus the role of real doctors. So I would imagine what he was talking about was an AI doctor. Our philosophy on that, and we really believe quite strongly in building human-in-the-loop AI and having AI in a supportive role to the healthcare professionals. And our philosophy longer term on that is that patients themselves will decide which aspects they're comfortable with AI taking over and when they want that to happen. And I think it's really important that it's the patients who are in charge of that. Ultimately, what we do works because people trust what we do. They trust the doctor, they trust the answer, they trust the advice, and they change their behavior as a result. So, and this is one of the big differences between what we're doing and, for example, the symptom checker. Symptom checkers, there's very little evidence that when someone uses a symptom checker, they then don't go to a doctor. If you're not changing behavior, then you're just a toy. You're not actually a tool. You're not really useful in the healthcare system, in my view. And so for us, it's very, very important to have the healthcare professional front and center because of the trust that generates and the behavior change that generates.
Right. No, makes sense, definitely. And I think future surprises us. So always, so let's see.
Let's see.
One of the things, Kim, I really wanted, you to expand is, the global business that you've built. And I'll tell you the context of it. So I, again, speak with a lot of health tech founders, especially early to mid stage. One of the things they want to do is expand to, like geographies outside their home country. So a US company would want to go to Europe and stuff, vice versa, maybe go into Asia markets and stuff. So since you have been there, done that, what are some of the lessons that you could share, if someone aspires to build their health tech company, have operations globally?
Yeah, that's a really, really interesting one. I mean, I mentioned earlier on what I see as the moral imperative of delivering health innovation globally. So I have certainly some advice on that, but I also have a little bit of an unfair advantage, which is that I was born both American and European. So was born in San Francisco, and I was born a Swedish citizen. I spent my summers in Sweden, and then my family for about 100. Sorry,
a big unfair advantage.
Yeah. Yeah, so I've always understood both those markets very well. And then my family has about a 140 year history of doing business across Asia as well. So that was very much integrated into my life. My mother grew up in Japan, and I have family members who have been living in countries all over Asia for, again, generations. So for me, it felt very natural to operate internationally from the beginning. But then in terms of the advice that I can give, we did a few things early on that I think made a very big difference. So one of them is we launched our service in 5 countries. And that was, I think there's a lot of structural decisions that you can make, which on the one hand may make your life more difficult in the short term, but in the long term will make it easier. And for me, that was one of them. So by challenging ourselves to launch in 5 markets in 5 languages, so they were the UK, France, Germany, Italy, Spain. So again, 5 languages as well. By doing that, it meant that all of the tech we used, all the infrastructure we built, all the basic assumptions about how we operate were multinational, multilingual from the beginning. And again, very conscious decision because we knew we wanted to go global in the end. So why not begin with the end in mind? So that would be one of my recommendations. If you want to build a global business, build it global from the beginning. And there's all these little things that if you don't do that, you'll forget. which is like, how are you going to label country versus language, and which ISO codes are you going to use, and these basic architectural choices, which to do them in reverse can be very, very challenging. If you force yourself to do it from the beginning, then it's much easier. The other thing I would say is hiring. We have a very, very diverse team of people. We are always looking for people from who speak more languages or have more backgrounds or experience working in different countries. They don't necessarily need to be from a place. They can have worked there or be experienced there, have a good knowledge of it. That's very helpful. Even just people who are well traveled have a global perspective on things and understand that healthcare systems are different in different parts of the world. People's basic assumptions, terminology is different. So all these little choices early on make it easier to scale internationally later. And then for us, we also chose to work with clients that were multinational. That was both because we could and because we wanted to. We saw it as a point of differentiation. The telemedicine industry is full of local companies, very, very few international players. Even the world's biggest telemedicine company, which presents itself as international, actually operates from a bunch of hubs and doesn't have a local presence in all the markets as we do. So again, these are who you associate with, both in terms of your colleagues and your clients, can also be a really key driver to internationalize.
Nice. It pretty much personifies what we call as like think global, think global as you do your business. So that's great. That's great. But what about the compliances and integrations for different, like different countries and stuff? Was it like a nightmare, or was there something again that you can advise the founders to?
Yeah, that's a really good point, and that's actually I should have mentioned that without you prompting it, because that's a really, really key element as well, which is particularly if you're operating in a regulated space like we are, choose your product wisely. So we have, particularly in the early days, we focused on the elements of what we're doing that are the most universal. So one of the big challenges that health tech companies have in the US, for example, is very often they're solving a problem that doesn't even exist in other parts of the world. It's a uniquely American problem. The US healthcare system is full of those.
Unique.
Yeah. And that's of course that's true in other countries as well. Again, there are whole concepts or whole ways of working that are unique to one country or one region in the healthcare space. So we really focused initially on a service that was universal, which was text advice. And that allowed us to make an offer or to roll out a service globally, which was a very light touch from the regulatory standpoint. Again, working with local doctors in every market gave us a significant advantage, because generally the regulations are really around protecting the power of local doctors. So if you're not crossing borders there, that is very helpful. And then from that initial service, which was again very universal to all healthcare systems, we've then expanded market by market into more integrated services, more deep services. For example, e-prescriptions, which require integrations with national e-prescribing systems, things like that. And of course, as you grow, you're then also able to put in place the sort of whether it's a regulatory question or legal reviews or all these more expensive, slow models. So I think when you can, in as much as it's possible, if you choose the elements of your service that are universal and that are a little bit lighter touch and don't come with as much regulatory burden, and then from there expand. And this is, I think, important principle for tech startups generally, which is, don't get ahead of yourself. You want to be, that question of being right on time with everything is really critical. You don't want to build something that people aren't ready to use or ready to pay for. At the same time, you don't want to be too late with things, particularly with a really regulated environment that we're working in. So I guess that would be my biggest piece of advice, and that certainly worked for us and allowed us then to be in the 40 countries and 26 languages that we operate in.
Great. That's great. So, I mean, of course, it would be, a lot of action, I can imagine every day, but that's great that you pulled it off. That's like, some success that, it's hard to get. So Well deserved.
Thank you. Thank you, Ayush.
Yeah. So one last question, and I'd like to keep this one interesting. I saw one of your stint was in Tanzania before this. What was that about? That did not sounded like healthcare. It was
Are,
some
are,
kind of
are
thing.
you are you asking because you have an interest in Tanzania yourself?
I'm always interested in
No?
wildlife, no doubt.
Okay. I thought maybe you may have been there. Yeah. So that was just a bit of a for fun project I did with my brother. I mentioned before that I had experience working in sub-Saharan Africa. So actually, I had started a mobile opinion polling business in Uganda using USSD technology for anyone listening who knows their old school mobile phone deep tech. That was a really fascinating project. I mean, we to some degree was looking for a country where there was the right balance in terms of the electoral process, where we could deploy opinion polls to try to. I mean, one of the issues with the electoral system is you've got that moment of the election, but what about between elections? How do you give a voice to public opinion in those moments? So that was really what that project was based on. We had a partnership with the biggest newspaper in Uganda. That got me to the region. My brother was there for business reasons as well. He's a funds lawyer with Clifford Chance, and was doing some work in the region as well. And we both just fell in love with the region and started looking for a good excuse to spend time there, and started a safari business. So again, it was just a hobby for a few years, but it kept us engaged with the region, gave us an excuse to go down there. Ended up getting involved in a few other projects in the region as well, and still I'm deeply engaged. Look, I've got a lot of love for a lot of parts of the world, but the East Africa in particular is close to my heart.
Great, great. Glad to know about that part of your work. Thank you. So, excellent talk. I really enjoyed this conversation, Kim, and thank you so much for sharing your insights. And we wish you all the best in your endeavors.
Thank you so much, Ayush. Take care.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.